Welcome to the second edition of the Economic Times Spectrum, Business Technology Virtual Conclave. I am joined by Dr. Sewak Sharma. He is the CEO of National Health Authority. Dr. R.S. Sharma is a 1978 batch IAS officer of Jharkhand cadre. He held responsibilities in his home cadre Jharkhand as well as in the ministries of the central government. He has been the Secretary of Ministry of Electronics and Information Technology in the Government of India and also the Chief Secretary of Jharkhand. As the first Director General of UIDIA, Dr. Sharma helped create the 12-digit unique identity number called Aadhaar. He has authored a book titled The Making of Aadhaar, World's Largest Identity Platform. He has also served as the Chairman of Telecom Regulatory Authority of India, TRAI. He is currently serving as the CEO of National Health Authority of India, which administers the Ayushman Bharat Yojana Health protection scheme. Dr. Sharma has the responsibility of spearheading the national effort of providing COVID-19 vaccines to the Indian population. He is the recipient of prestigious Prime Minister's Award for Excellence in the Public Administration in 2008. Welcome, Dr. Sharma.
Thank you very much, Arpit, for having me on this conference.
To begin the discussion, sir, I would like to understand the digital healthcare is the future of the health sector, and technology is going to revolutionize the health sector. What do you think in the context of national digital health ecosystem?
Arpit, let me just say that Corona, at least this pandemic, has taught us one thing, that we will have to in future do things in a digital way. For example, we are meeting in a virtual manner today, and we are having a number of virtual meetings. So what has this taught us is that we can leverage the information and communication technologies in delivering services in a digital way, and health services are no exception to that, because many of the health services can be delivered, such as consultations. Drugs can be delivered using the digital means, or online delivery of drugs is possible. And similarly, the records, the medical records, can be digitally stored and shared across the hospitals and the medical service providers. So therefore, a lot of these digital technologies can be leveraged. Also, the fact that India has uniquely created some digital goods, public goods, like digital identity, consent artifact, digital payment systems, which are extremely scalable, digital authentication. And these things make it possible to create a digital ecosystem for delivery of health services, which I think the National Digital Health Mission, the program announced by the Honorable Prime Minister on 15th of August last year, that is going to play an extremely important role in this journey. Let me also say that this is not a government program in the traditional sense of the term. What the government is doing is essentially creating an ecosystem of the patients, the health service providers, the laboratories, the hospitals, and the doctors, and the nursing staff, etc., so as to put them onto a grid where they can be kind of connected digitally, and then they can deliver many of these consultations and services digitally. So that's actually, we are just building a platform which will enable the delivery of these digital services using some of the unique artifacts which India has created, such as digital identity, authentication, consent artifact, and other things.
Sir, as you said, the National Digital Health Mission plans to develop an integrated digital health infrastructure of the country. How will it bridge the gap amongst different stakeholders of the healthcare ecosystem through digital highways?
So what is going to happen is that it will, first of all, make the services ubiquitous, even in rural areas. For example, now what we have is, while we have in the urban areas a lot of physical digital infrastructure, doctors are there, the doctors, they are not reaching to far-flung rural areas because there are no facilities of accommodation, facilities of children's education, etc. Now this will actually reduce that divide. And for example, video conferencing, anybody sitting in Mumbai can actually provide video consultations to anybody sitting in remote areas of Jharkhand. So that way, I think it will extend the digital, the delivery of health services. Similarly, other components, I mean, I do agree that there are certain things which cannot be done digitally. For example, when you go to hospital, hospitalization cannot be done digitally, certainly. But then, you will be able to search the hospital, search the doctors, talk to them, and therefore it will become easy for people to get these services. So in a way, digital technologies will help to actually extend these services in a more equitable manner.
That means that you are saying India needs digital health. And if India needs digital health, how can technologies like artificial intelligence, machine learning be leveraged to develop a robust and secure healthcare infrastructure?
I think I did not even talk about these. You are very right, and it's a very good question which you asked me, because I think once you have more and more digital footprints relating to the prescriptions, relating to other kinds of things, then a lot of data will be generated, and that data, without, of course, violating the privacy, can be leveraged to devise, divide health policies, the what kind of diseases we have in the country, what kind of, lot of data analytics can be done. And once you have large amount of data, then of course you can do artificial intelligence, you can do even the diagnostic tools can be improved. For example, today you have expert systems which can provide diagnosis if you plug in the various symptoms, etc. So those things can also be put into service, which will actually make things much more easy and much more productive.
Sir, when we are talking about digital technologies, so digital and emerging technologies also have shown us the way as of now. But how do you see the long-term impact of COVID-19 on work, workplace, and workforce?
Well, COVID-19 has, of course, it is a very tragic event which has happened in the world. But at the same time, every tragedy also, points to some opportunities. And one opportunity which has, come out of this is essentially work from home. And it has taught us that it is possible to work from home with equal efficiency, at least in many sectors and many areas. And therefore, this is one lesson which it has given. Today, we feel much more confident in basically having the video conferencing without traveling to these places. We can have meetings sitting at home. On an average, for example, I am having at least 5 or 6 meetings per day, sitting in my office or sitting, at home, which is actually a good way, in the sense that it reduces the travel time, it reduces probably the expenses, it reduces the environmental, sort of impact of all those travels and all that. So I think it reduces the crowding on the roads. So there are certain positive aspects which this pandemic has taught us.
Sir, let's talk about the vaccine part also. You are the chairperson of an empowered committee for the COVID-19 vaccine delivery technology platform called CoWIN. So how challenging has been the assignment of meeting the delivery targets for the COVID vaccine by fixing the glitches in the tech platform, this
Well,
CoWIN?
I think the Honorable Prime Minister launched this drive, countrywide drive on 16th of January. And at that time, we started building this platform. So initially there were certain glitches in the system. But as it happens with almost any system, but I think these glitches were fixed in a matter of days, in 5, 6 days. And since then, we have had no glitches, significant glitches. We have been upgrading the system since then, and as now the system has got about 18 crore vaccines have taken place. System has a huge real-time recording of vaccine events. System is delivering certificates, also enabling people to register on the system and get the appointments. The system is highly scalable. Imagine that 28th of April at 4 p.m. we opened the 18 to 44 registrations, and in a matter of 8 hours we had 1.37 crore registrations on the platform. We have seen the 55,000 concurrent hitting of the platform per second, 55,000 people per second. So I think it has been an extremely, interesting sort of experience for me. But also remember that India has done projects like Aadhaar, which is actually we created 1.27 billion identities, and that is also a very technologically complex project. So I think in comparison to that, this is a really an easy stuff. The only thing which we have to do is to make it inclusive for the people, because there should not be very difficult process of registration and also of seeking appointments, and then inclusive for everybody else in the ecosystem, which is the vaccination centers and the hospitals and the vaccinators and other ecosystem partners. Now that we have the private sector also participating in it, we are actually extending the system, and we have continued to sort of include new features into the system. For example, now we have reservation for the second dose, and other kinds of systems have been added up.
Sir, we already have a centralized system called CoWIN. I would like to specifically mention here the case of Chhattisgarh state. They have also developed a similar platform called CG Tika. So how important are such innovations during these testing times?
Absolutely no problems, because what we have done is we have since the very beginning designed the software to be API based, which means the software should basically connect with other front end softwares, so long as they are able to comply with the API policy of the software of COVID. So long as they provide us the basic information relating to vaccines, the kind of vaccines which are being delivered, the immutable vaccine event records, downloading of certificates, we have absolutely no problem if the states or even private players actually add new innovations onto the front end. And we are in a couple of days going to open the policies even for private players. We have already opened up the vacancies and the certificate download systems to private players, to an open ecosystem, and many people are actually using it. We now don't require you to log into the system to look at the vacancies, and that is being used by a number of private players also.
Sir, every crisis brings opportunity as you talk about the private sector. So I would like to also ask you, India's health tech industry is likely to touch the figure of $5 billion. That is approx 37,500 crore by 2023. This is a study of Internet and Mobile Association of India. In what ways it could open up new opportunities for the healthcare sector in India?
Well, Arpit, let me tell you, India is actually going to have a quantum jump in the digital and communication technologies. The reason is simple. We created first the digital identity infrastructure. Then we created a number of products on top of it. We created the electronic KYC, we created authentication, we created consent framework, and also, so basically we created all the artifacts required for a paperless, presence-less and cashless governance. So for example, we created the UPI, the Unified Payment Interface, and today we have as much as 3 billion transactions per month. 3 billion is 300 crore transactions per month. So it's actually what you can say 10 crore transactions per day, which is a huge number of transactions. So that is something which we created. Thereafter, we are now sort of venturing into various areas, and health is one of the areas where we are using and we are creating digital technology platforms. Similarly, education. Similarly, there are multiple areas where India is going to lead because of the kind of platforms which India has created. And now we have an experience of creating open, standard, open API based platforms in various sectors. So you will not be surprised if we do the after digital health, we consequently we also do digital education mission, which will actually, in a way, be very, very ubiquitous digital learning platforms. So I think a lot of things are going to happen in our country, and we are going to become, and of course, this is the only country which has actually adopted what is called data empowerment and protection architecture, where we are saying that the person whose data it is actually should be in control of the data. And that is very important, and I should be able to use my data for my benefit. So for example, the account aggregator concept in the financial sector is actually going to create a huge amount of credit explosion in some sense, because you can have digital credits availability and many other things. The UPI is doing many other new features like call correct facilities for payments. A taxi wala can just send you a request on your UPI address to pay money to him, and you just have to say okay and not okay. So that's the kind of system which we are going to have. So now with this experience and these products under our belt, we are going to kind of explode our experiments, and we are going to build a new platforms in many sectors, including the health.
Thank you for highlighting these, sir. I would also like to ask some questions about Ayushman Bharat, Pradhan Mantri Jan Arogya Yojana. Sir, how are you using artificial intelligence, machine learning, and other emerging technologies for fraud analytics? And where do you see role of technology in Ayushman Bharat?
The Ayushman Bharat, by the way, let me also tell you that Ayushman Bharat is the only insurance scheme in the world, is the largest insurance scheme which covers 54 crore people of this country. It is also a scheme where you have a paperless, kind of system of the disposal of the health claims, reimbursement claims, insurance claims, and that certainly the platform is using a lot of technologies like authentication technology to recognize that the person who is claiming the benefit is actually the person who was treated, and also to ensure that the transaction, the treatment management system, which means that whatever disease you have claimed your sort of reimbursement for, is actually we are using fraud analytics, the artificial intelligence, and all these technologies are being used at the back end to kind of catch hold of if there are frauds which are happening in the system. We will catch them and stuff like that. So a lot of technologies are being used at the back end in our claim settlement platform.
So there have been certain areas for improvement also in this scheme. As the scheme was launched in 2018, it's been 3 years. What are those areas that you have found in the study so far?
No, one is the area of ensuring that all these people who are the beneficiaries of Ayushman Bharat should be informed and should be empowered. So what has happened is that while whether you are a beneficiary of Ayushman Bharat or not is based on your entry into the socio-economic caste census done in 2011, it's also important that you are aware, you as a person are aware that you are indeed a beneficiary. And therefore, we have decided that all those people who are beneficiaries should be given some kind of token. So we are issuing a PVC card to them, which basically will work like a entitlement, token. When they go to the hospital, they can claim that I am the Ayushman Bharat beneficiary. So this is one improvement we are going to do so as to improve the coverage more and more. And of course, every program, obviously has a scope for improvements, and we are making improvement in the beneficiary identification system. We are making improvement in the rates of the reimbursement claims. We are constantly sort of innovating and improving, finding out on a data driven method, finding out the problems and then trying to solve those problems. Of course, because the numbers are very large, we are able to use the data to fine tune our policies.
Sir, you have very vast experience in the technology sector. How can this technology help achieve the universal health coverage? And what is being done to secure the data, since a lot of huge volume of data is being generated?
Yeah, absolutely. Let me talk with the security part. One is that, the National Digital Health Mission or the other digital technologies, whichever platforms India is building, we have actually two concepts which are the foundation of all our platforms. One is privacy by design, which means we design the platform keeping privacy in mind. And that is why, if you remember, Aadhaar, which was built in 2010 and which was challenged in the 2015 onwards by a number of PILs in the Supreme Court, and there was no privacy law. And thereafter, the Supreme Court decided that privacy is a fundamental right. And then it went on to decide as to whether Aadhaar violates that fundamental rights or not. And then it was decided that the Aadhaar does not violate any fundamental right. It does not create a surveillance structure, which people were alleging. It does not profile people, or it does not violate the privacy of the people. So, therefore, authentication also does not violate the privacy. So, therefore, we have privacy by design as one principle. Secondly, minimal data collection is another principle. We should collect the data only what is required. So, for example, in COVID also we are collecting only the name, gender, and the age, year of birth, nothing else. So, minimal data collection, privacy by design, and lastly, federated data architecture, which means the data should remain where it has been generated. For example, if my records, medical records, are in Apollo Hospital, they will remain in Apollo Hospital. Obviously, they can be fetched by me, and therefore we are creating an architecture whereby, using my consent, I can enable the data of Apollo to be seen and fetched and viewed by a doctor in all India Institute of Medical Science. So that's the way it is. So federated architecture also actually ensures that I am not becoming a data warehouse. The National Digital Health Mission is not the one which is storing everybody's data. Basically, the health records are remaining with the hospital's concern. So the federated architecture also ensures privacy as a construct by design. So these are some of the principles which we are employing in our architecture, so as to ensure that we don't violate privacy, which is a fundamental right of the citizens.
My last question to you, sir, what are your priorities for the current fiscal? And as a lot of business leaders, CXOs, and technology players are listening to this conversation, any message for them?
No, I really am not a great person to have to give you the message. I can only say that, I would recommend that all the private sector participants in the health ecosystem, we should come together, and as a nation, we should build a grid of the, private service delivery in the health sector. And that is what National Digital Health Mission is all about. And therefore, if we all collectively come together, and let me assure you, nobody is going to lose in this game. Nobody is going to corner. It's not an internet type of global giants like Facebook or Amazon and all that. We are not going to do Amazonification of the health services. Certainly not. So therefore, everybody has a play. Even a single doctor will have as much visibility on the platform as a big hospital. So therefore, it's a very, very non-discretionary, level playing field platform which is being built, and everybody should collaborate, and let us give our nation a very robust platform of health related service deliveries. We have all realized how important health is in these COVID times, and therefore it's important for us to create such platform.
Thank you, Dr. Sharma, for sparing your time for today's show, and it was indeed a great pleasure to have interacted with you. Thank you so much.
Thank you so much, Arpit. I've also enjoyed talking to you.